There we go. Now we're officially live. Alrighty. Good afternoon, everybody. I see our guests will start trickling in here. And as we wait for our guests, as we get into it, I firstly just want to say it has been a long month. It feels like a month that has been longer than any other month. But it's been a very important month and a very important reason as to why we're sitting here today. And that is because we are having, or not we are having, but it's Men's Mental Health Awareness Month, the month of November. And part of what we're trying to do in this session is just to raise awareness on a few health issues that men deal with, and to have a discussion around a few of those things. And in doing this, we're breaking a stigma around the fact that men do not speak, around emotional suppression, around self-reliance, all these things that sometimes can cripple us as men and lead us to a corner where we think taking our own lives and self-harm being the solution. So without any further ado, I'm quickly just going to introduce our esteemed guest for today, which I've been frothing to speak to all week, and our special guest as well. So this session mainly is the men of Umuzi, the men of our community, and we want to drive a conversation internally, but we thought it would be best to also have a special guest. So I'm just going to quickly run you through these amazing gentlemen who've decided to step forward and have this conversation with us. In no particular order, we have got Nduduzo Nyanda, head of partnerships at Umuzi. And Nduduzo's background is that he is a trained spatial planner with a background in transport planning and operations. He has an extensive background in the tech space, which spans from Uber to Click Learning, and now he's joined the dream team, Umuzi. Nduduzo also sits on the board of the Johannesburg Child's Welfare, where he serves as a treasurer. Nduduzo, it is lovely to have you here. Thank you for availing yourself.
Thanks for having me. And hello, everybody. Can't wait to have a conversation.
Amazing stuff. Just to our audience, as you have any comments, as you have any questions, we know that Umuzi is a remote organization, right? We've got people all over the world, all over the country. Let us know where you're tuning in from. Let us know where you're dropping in from, and we can share those on the screen as well. Our second esteemed guest today is an Umuzi alumni, a man who comes from within our system, and a man who sometimes calls himself Mbeki with the good hair. I'm talking about Patamedi Lebea, who is a copywriter and a consultant at Visual Meaning in the UK. Patamedi, beyond his 9-to-5 writer job, he's a content producer, a writer, and a broadcaster, in which we see this man is very busy, no rest for the wicked, but he still decided to give us his time. He's born and raised in Johannesburg and embodies the spirit of an African with dreams he cannot afford to sleep on, and ancestors that died for him. So, Patamedi, thank you so much for availing yourself as an alumni. We are super excited to have you on this panel to have this conversation with you.
Good to be here.
We've then got a close friend of mine, Muzi Maphope, an LX coach, who works very tightly with our learners. Muzi has been with Umuzi for a while now, and he's here to share from more a different perspective when it comes to men's health, and what he's observed and on his young journey as a coach at Umuzi. We then have our very, very, very special guest, which I'm going to hand over to very shortly, who is Dr. Leroy Witbooi. Everyone's been asking me, how do you know Dr. Leroy? Is he your doctor? No, he's not my doctor, but not yet. But it is through a mutual panel discussion that we're going to be a part of. But just to give this intro to the special guest that we have here, who's going to be so informative for us. He's a urologist with a decade of clinical experience. And Dr. Leroy embarked on his medical journey with an MBCHB from University of Stellenbosch in 2009. His love for urology culminated in him obtaining a fellowship from the College of Urologists in 2023. and also an M.Med role from Sefako Makgato University in 2024. Dr. Leroy, you've clearly done some amazing things in your life. We're super excited to have you here. But what actually stands out for me when it comes to your bio is the fact that you're an Eastern Cape gentleman, which makes all the sense as to why you're a lovely fellow. Or at least your career started in the Eastern Cape at Usenik Provincial Hospital, followed by community service at PE Provincial Hospital. It's a pleasure to have you here, and we're keen to hear about your approach and how you deal with issues and just enlightening us on testis cancer. So without any further ado, I'm going to hand over to Dr. Leroy, and just to give the audience a flow of how this session is going to be, just to manage expectations. All right, you are more than happy. We encourage you to ask questions as we go. We will give them a chance, and at the end. But Dr. Leroy is going to give us a presentation on testicular cancer to raise awareness on that, and then we're going to get into a discussion about what's been raised and a few other issues around men's mental health, and just some treatment options available around all those things. Dr. Leroy, I'm going to hand over to you. Thank you so much.
Thank you, Mr. Yanga. That was quite the introduction. I'm not sure if I had warranted that, but just a simple, here's the guy would have done. Today, I've prepared a short presentation for a topic that I think is of great value, especially to our younger audience. It's testicular cancer. And just in case anybody is unsure of which organ I'm talking about, I think the little leather baggie will make it quite clear. So we can move on to the first slide. I've decided to approach the topic by asking simple questions and answering them as best as I can to accommodate everybody in the audience. And everybody should feel free to ask any questions if there's any confusion as to what I'm saying, or if there's more info that I can add on. So the first question is, how common is testicular cancer? So as you can see, testicular cancer makes up 1% of adult male cancers in the world, with a peak incidence between the ages of 25 to 35. So that's kind of scary, a time when guys are feeling froggy. That's when testicular cancer can develop. And then just to put the stats into a different way, it's depending where you are in the world, about 3 to 10 people per 100,000 men per year will develop new cases of testicular cancer. So it's not very common, luckily. So who is at risk for developing testicular cancer? So studies have shown that people of European descent are at the highest risk. In a country in the US where there's a big population of both people of European descent and African descent and Caribbean descent, it's found that the risk for Caucasian people is about 3.6 times as high as it is for the Black population in the US. Then the other big risk factor is patients who have a history of undescended testes. So these are little boys whose testicles have not descended into the scrotum by the time that they are born. If left untreated, there's a 4 to 6-fold increase in the risk. But if treated, the risk is only 2 to 3 times as great. And the treatment should happen before puberty to have this effect. After puberty, the risk stays the same. Then a family history of having testicular cancer, and what we mean by this is a first-degree relative. So as a young man, that would be your dad or your brothers having a history of testicular cancer. Your third cousin once removed having a testicular cancer is not a relevant history, luckily. And then also somebody who's had a personal history of having had testicular cancer on one side is at greater risk for developing cancer on the other side. And then the last point is that there are certain precursor lesions that urologists will look out for. It's not, luckily also again, not very common. So we can move on to the next slide. What are the signs and symptoms of testicular cancer? So by far the most common is feeling a painless lump in your testicle or in your scrotum. It's by far the most common, but sometimes patients will say something like, yeah, I bumped myself and then I noticed the lump and it wouldn't go away after a while. The lump was probably there beforehand. The bump probably just drew your attention to it. So a painless testicular swelling, please, if you feel any of those, find a doctor, we can examine. Then the less common ways in which they present is with pain in the testicles, with or without a swelling. And very rarely people who come to seek help with infertility, we find that they have testicular cancers. Again, luckily, very rarely. And then gynecomastia is just a fancy Latin word for having painful swollen breasts in a man. Obviously, ladies is not relevant to. But yeah, the development of a swollen, painful breast tissue should alert you to seek attention. Then the question is, what else could the swelling be? And again, luckily, all of these other diagnoses we see so much more often than testicular cancer. So the first is orchitis, or inflammation or infection of the testicle, which leads to pain and swelling. Second would be a torsion. This is when the testicle turns by itself and causes a little bit of pain and discomfort and swelling. And then a very common thing that guys present with is a spermatocele or an epididymal head cyst. This is an innocent little swelling on the tubes that are taking sperm from the testicle to the outside world. The vast majority of painless swollen lumps in the testicles we see are fortunately these, and they're imminently treatable and are not dangerous at all. And then the last and probably the most dangerous thing on this list is a inguinal hernia, where the bowel makes its way down into the scrotum and presents as a lump, usually painful, but it can also be painless. But yeah, hernias are serious, is a serious condition and requires a general surgeon's assistance. Then how does your doctor diagnose testicular cancer? I also just added here, how do we stage it? So the first is a clinical exam. Your doctor is going to sit you down, have a long chat with you, listening to your complaint. Then by clinically examining you, so that'll be, hopefully they put on gloves and they'll examine the testicles and your genital area. And then the best modality to diagnose testicular cancer is with a scrotal ultrasound. This is a very common examination to be done. It is painless. Very, very important to mention. It's not painful to have an ultrasound done, and ultrasounds are readily available in most urologist rooms, and we do them ourselves. And they're very, very sensitive and specific for looking for lumps in your testicles that could be cancers. Your doctor will also perform certain blood tests, baseline blood tests of your hemoglobin levels, your kidney function, and then also checking specific tumor markers to help them diagnose the testicular cancer, and then to ascertain how the stage of the disease or the extent of disease. We will perform X-rays, CT scans, and in certain people who can't have CT scans, we will perform MRI scans. Again, these are imaging, luckily not painful, and readily available in South Africa. Can we have the next slide, please? So how is testicular cancer treated, and what are the outcomes? So the first and the gold standard of treatment for cure is to do radical surgery. And unfortunately, gentlemen, that does mean that we take the entire testicle out. And if you request, we will put in a prosthesis for you. People walk around with fake eyes and fake teeth. You can walk around with a fake testicle. Testis sparing surgery can be done, but in very, very, very rare circumstances. These are those unfortunate guys who were either born with one testicle or who has had or has testicular cancer in both testes at the same time. These are very, very, very exceptional cases. Luckily, very rare to have two cancers at the same time. The point of the testicular sparing surgery is to mitigate the need for testosterone supplementation after surgery. Chemotherapy is given to the patient. It's platinum-based chemotherapy, and since the advent of platinum-based chemotherapy, the survival rates has skyrocketed, fortunately. In certain rare cases, one will need to irradiate the patient, so that's giving radiotherapy. And certain instances, we will perform lymph node dissections. This is where we cut a few of the glands out from within the abdomen. And then the last line shows that the survival rates, the 5-year overall survival rates for testicular cancer. So if the disease is confined to the testicle alone, there's a 99.2% survival rate. If it's regional disease, meaning 1 or 2 lymph nodes in the area, it's still very, very good. It's 96.4%. And if there's distant disease, in other words, if the disease has spread to certain organs, in particular, we're thinking about the lungs, sometimes the bones, you still have a 72.8% survival rate following surgery and chemotherapy for these patients. So the take-home message that I have for our listeners is that, fortunately, testicular cancer is very rare. Second point is that testicular cancer is curable. And lastly, by doing self-examinations, you will notice and diagnose your testicular cancer quite early. And the self-examination could save your life. So next time somebody tells you to take your hand out your pants, tell them you're busy saving your life. And then lastly, just a little bit of shameless self-promotion. Thank you for everybody's attention. I hope we all learned a little something.
Dr. Witbooi, that was incredible. Thank you so much. You made me chuckle there. You're giving me a reason to walk around with my hands in my pants now. I'm joking. No, but that was awesome. And if you're on the audience wondering, okay, you just got this information, what is it? And I'm going to go through some questions that I have as well, and I'm sure some of our panelists may have as well, Dr. Leroy. But cancer is one of the leading health issues when it comes to men, especially testicular cancer. Although it's rare, sometimes it's because of lack of awareness or lack of knowledge that we don't prevent early, or we find ourselves in situations where you didn't know. And this session is to enlighten you on that, on one of the issues that happened. So, Doc, throughout your presentation, you mentioned who's at risk, Caucasian and that sort of thing. I want to know, when it comes to screening and self-examination, how regularly should one get screening done? And in terms of age factors, is there any age where you're at a certain age where you're at risk, low at risk, or high at risk? What answers do you have?
Sure. So in truth, germ cell testicular tumors are extremely rare before puberty. So you can really start self-examining, in the shower by yourself every day if you must, from about puberty. But like I said, the peak incidence we see is somewhere between the 2nd and 3rd decade of life. So between the ages of about 25 and 35. As far as screening goes, the screening programs have been rolled out across the world, and it doesn't seem to have done any better than self-examination, in all honesty. So, I mean, it's like one of those things that we tell our patients: when you pull down your pants to go and pee, you're looking at your genitals every day. Just have a feel, make sure that there's nothing funny going on down there. But yeah, just regular examination, if you remember, every once in a while to just make sure. Alternatively, you can just ask a friend. It always helps.
That's a funny one, but that's a great one. Are there any other questions from the panelists, perhaps, if you'd like to say any questions that you have around testicular cancer, around awareness? Patamedi, I see you nodding your head. Do you have any questions for Dr. Leroy?
Muzi turned his mic on first, so it's only.
Okay,
cool,
I'll let
cool,
Muzi.
cool, thanks. I think I would like to know more of like the cost around, the process of screening, and also like, the treatment, what are we looking at, especially for like people who are not on medical aid and stuff like that?
Okay. That's a bit of a tricky question to answer, because in all honesty, I do not know how much that chemotherapy costs. it usually gets done by the oncologist. So we do our surgical bit and we refer those on. As far as the medical aid question, or patients who don't have medical aids, I can attest personally that I've treated a few people with testicular cancer while I was working in the state. We have all the drugs in state service, and the surgery is readily performed there. I mean, we all train in the state service, so the expertise is there for those people who are in dire financial need. But for the most part, people who have a medical aid, because it's a cancer, medical aids will pay virtually the entire cost. There's almost no extra cost that they would endure. But off by heart, I can't tell you how much the the admissions and those things cost in private. But as I said, the capabilities are definitely there for to be treated in the state for those who maybe are unable to endure the cost of private healthcare, or who doesn't have a medical aid.
That's awesome. Thank you, Doc. We're going to take one more question from our panel and then one more from the audience before we get into a little bit of a discussion, just for the sake of time. Yes, Nduduzo.
Thanks so much for that presentation, Doc. I think mine is sort of like, unfortunately, two questions.
Fine. You have two testicles, it's fine.
I think the first one, I think it's sort of like segues from Muzi's question. And I think you sort of touched on it with your experience in the state. Well, my question would be, I think after an individual self-examines, I think given limited resources, what would the next steps be? Because I imagine it wouldn't necessarily go straight to a urologist. In terms of confirming what that would look like. And then I think the second question would be, given I think some of the stats that you've mentioned around who testicular cancer actually affects, would it be fair then well, what would, I think from your perspective, would be, I think, the one, I think, condition, would I put it that way, that would mainly affect, I think, maybe like African men or men of color?
Okay, so the truth about testicular cancer is anybody can get it. It's just the risk is greater in the Caucasian population. Secondly, there's no racial disparity between undescended testicles. And that's a major risk factor for developing testicular cancer. So irrespective of whether you are of African descent or Caucasian descent, if you've had undescended testes, you need to be very aware that you need to monitor yourself. Indeed, part of sometimes when we find people with undescended testes, particularly older ones, who even if you perform the surgery, you're not going to necessarily or perform the surgery to bring the testes down into the scrotum. One of the main purposes for that is so that that patient themselves can screen themselves, can self-examine, so that if something changes, they're able to feel and seek help after that. Then to your first question, sir, in all honesty, your first port of call needs to be a general practitioner. They will examine you. They can do the blood tests themselves. And if there's anything abnormal based on that, and they'll also request the sonar from a radiologist, or if they are skilled enough, because there are GPs out there who've done courses on sonography. They might be able to perform the sonar themselves, but if they can't, they'll refer the patient to somebody who can. And then from there, they will refer the patient on to a urologist. So even in our communities, we used to get these kind of serious referrals with cancer cases. We used to get them from our local clinics and our peripheral hospitals, the provincial hospitals. The doctors, they know what to do as well, because we all, when you're doing general medicine, you do spend some time learning a little bit of every discipline. And testicular cancer is one of those things that jumps out because it's pretty simple to diagnose even as a general practice. So you don't need, you're right, most of the time your first port of call won't be a urologist, but I always tell people whenever they ask me about health advice and things that they can do, I always want to emphasize that the most important relationship for your health is the one that you have with your general practitioner. That's somebody who's going to be looking after you for most of your life, hopefully, and you have a good relationship with them and they've been following you for years. So that relationship is by far the most important. We as specialists, we do our little thing with patients and then we send them back to their general practitioners to follow up with them and stay in their care. So having a trusted GP is priceless.
Amazing, amazing. A mouthful of information in our first part of the presentation. Dr. Leroy, again, thank you for such an informative presentation. Thank you for the great questions to our panelists. And it leads us on to our next part of the discussion, which is talking about, mental health. And before I get into that, I want to quickly just get into the pillars of what we define as well-being, all right? And wellness, being physical health, our mental health, our social health, right? Our professional health, right? And our spiritual health, okay? And all these things are intertwined, right? And what we've gotten from Dr. Rio now is the medical side, right? And one of the issues from a medical side that are the leading killers for men. But from a mental side, right? The numbers that we're currently facing and looking at are extremely scary. What was previously known as Movember, which is now Brovember, which is an organization that is coming forward to essentially stop men from dying prematurely. Every 80 minutes, one man commits suicide. And it's for reasons like struggling to speak about our emotions, struggling to speak about our feelings, struggling to speak about the things that are challenging us. We're speaking about, Dr. Leroy is telling us we should go see our health professional, go see a doctor. But one of the things we've noticed in men is that we struggle to ask for help or struggle to speak. And men avoid the doctor, right? And a big part of it, I believe as well, is that vulnerability, right? That fear of being seen as weak, or that fear of the news that may come about that may perhaps be not something you want to hear and not being able to deal with that. So I want to pose a question to our panelists. As men, you've obviously felt this feeling as well, but why do we struggle to seek for help? Why do we struggle to say, hey, whatever pillar it is of well-being, why is it that we don't do that? I'm going to throw this question at Patamedi to just tell us why do you think men struggle to speak about their emotions and feelings and ask for help?
Yeah, that's a good question. I won't have an answer for all men, but I think that from the guys that I'm associated to, men in my life and the conversations I've had and personal experience as well, is a combination of like expectations, both from like our world around us and from ourselves. Things that I experienced in my own, just like growing up, losing my father when I was really young, and statements like, you are now the man of the house, with no real like explanation, or like there's no guidance of what a man looks like, what a man is, what those expectations are. And then just naturally making assumptions that, oh, this is what's expected of me. Mom's in a tough situation, therefore I should, be the strong one. But then definitions of strong become complicated. All of this to say that it just feels like miscommunication or non-communication that causes a lot of the challenges that I've in the men in my life and the conversations I've had, where this pressure and this understanding that we've developed around what it means to be a man, things around men and crying, these weird ideals that exist in the world, but we never really sure where they come from and never question. And it speaks to exactly that. I'll speak from experience. I have the same thing. Like, only in the past 2-3 years has it been a thing where I go, hey, why don't you actually go to the doctor? What's wrong with that? It's just the thing. I've accepted that, hey, everybody else, if the household's fine, I'm fine. If things are taken care of, I'm good. If I'm strong, everybody else around me is strong. And these ideals are really weird. But again, it's either miscommunication or non-communication. Someone had the wrong message and passed it on, or we just never spoke about it.
That's a great answer. And you mentioned something very, very, very key there, which is that cultural and societal norm around how men should be, right? And you mentioned a few things there. If I say a few statements here, I know they all hit home, right? And for all of you on the panel here, if I say, toughen up, all right, I'm sure that message, that those words hit home, or men don't cry, or a real man, all right? And all these statements are stopping us from seeking help. Because why? Because we want to be self-reliant. Muzi, I'm going to ask you to just add a little bit to that point as to why you think we as men struggle to seek for help.
I think also, out of what Patamedi said is like having that safe space, people around you not being able to receive, or you feeling like whatever I say to this person, they won't be able to receive it the way, you can't fully be honest about how you're feeling, I've gone through that with like the people around me, my family, my mom, and it's like you have to be like a man, but also you also need guidance. So it's a lot of, but mainly having that safe space to say, look, if I'm down, I'm down, and I can say, look, I'm not okay, and I won't be judged, or I won't be looked at as like, oh, man, he's always complaining, those type of things. So yeah, for me, it's been mainly like a safe space type of thing. And yeah, and I think I just learned to live with it. It became like a norm. Like if I'm sad, I'm just gonna isolate. I'll come back when I'm good, or I'm just gonna go for a run. I'll be better after that, or a drive or whatever, but actually voicing out how I feel, even to myself, to say, oh, actually I'm not okay, has been like one of the biggest challenges that I faced personally,
Yeah, no, and thank you for sharing that. And you mentioned something again that's important there is in that confidentiality, essentially. Like as men, you feeling like, if I share this, is my information safe? Because again, it's that fear of vulnerability and weakness. And for more extended, is it safe with that person? And I think it also leads me to a point I want to mention in around holding those safe spaces, right, as men. Because something quite often I found is that being vulnerable and speaking requires for there to be a little bit of discomfort, right? It's very uncomfortable to speak about your emotions and your feelings. And, going to another brother and taking that, they need to be able to also hold that discomfort, right? And sometimes I feel with men that we struggle with holding those spaces, right, for each other, right? Being able to sit in that discomfort to talk about these things. And we'd rather talk about the football game that's coming up because it's a little bit lighthearted, right? Or not talk about the thing that's going on. And there's risk to that. And you mentioned something there, Muzi, about isolating. And there's a few things that society links to what masculinity should be. And I'm quickly going to run through them. But the first one is emotional suppression, which we've just spoken about, right? The second one is that self-reliance, right? The third one is aggression and violence, all right, in the sense that, we often attested to that. And there's risks. There's risks to this masculinity, and one could also call it toxic masculinity. And I want to pose this question at Nduduzo and Dr. Leo as well, in terms of, when it comes to masculinity, obviously there's risks. There's risks when we say men must be self-reliant. There's risk when we say, a man must suppress his emotions. At least that's how we see it. What do you think those risks are of that toxic masculinity? Is the question I wanna throw at you, Nduduzo.
Oh wow. I think I'd like to sort of like take this. I'd like to take like a short left here, in terms of how you pose that question, right? And in trying to understand from a different lens what we look at as that toxic masculinity, right? And I'd sort of like to apply sort of like my personal experience of this in some of the spaces that I've moved in. I think the irony is with some of that toxic masculinity, and I think everybody from Patamedi and Muzi have touched on this around how men in general, especially I would say in an African sense, have had, I think, weird expectations, I think, brought onto them. And I think just this is also men in general, right? In terms of being a provider, being stoic, being this, being a protector. But I think there are a few other externalities that also come into play. I think about it from almost like my family lineage. I grew up in a world where I didn't know any of both my maternal and my paternal grandfathers. And I think when you probe that question in the family, it literally is apparently they just dropped dead, right? And when you start interrogating some of those, and these are men who were, again, providers for the family, stoic, all of these amazing things. Because when my mom and my dad and my uncles and aunts speak about these men, they have all these great stories about them. But mysteriously, they just dropped dead. And it wasn't until probably like 10, 15 years ago, my dad's older brother was diagnosed with prostate cancer. Luckily, it was caught quickly, but he had to have his prostate removed. A few years ago, 6, 7 years ago, my dad was then diagnosed with prostate cancer, and he's still undergoing chemo. And one of the first questions I actually asked, I was like, wait, so this clearly could actually be hereditary. Why hasn't anybody spoken about it or actually interrogated it? And the irony is also in that I've had my mom, like aunts and mothers, nurses, right? But those connections kind of aren't being made. And what I question is, and it goes back to this whole toxic masculinity piece. And what I think as men, what we are, I think, inherently passing on not only to our kids, but to each other is, and I wonder if it isn't just a function of not actually having a vocabulary, right? And being exposed to, I think, various levels of either teachings or information, like the good doctor right now is actually sharing. Because I can tell you for a fact, and these also sort of bleed into cultural norms where I think there's this almost like disconnect between what is, I think, culturally teachings and learnings between men and what and how men actually interact with society and those expectations with what I think the rest of the world, in, I guess, a neoliberal sense, in the position and in the direction that it's moving. And I wonder, in a sense, if those might actually be in some form juxtaposing ideas as opposed to being collaborative ideas that actually then also perpetuate this sense of toxic masculinity.
That is definitely a different lens and a different view. And thank you for getting into the depths of your family story with that. Dr. Leroy, would you like to add onto what Nduduzo said? And before you answer that question, we will step into next, which is another question I was going to throw at you, Doc, as you open your eyes up wide, is the link between our mental health and the physical health. But yes, do you want to add anything onto Nduduzo's point?
So what I would like to just add on is your initial question was, what are the risks associated with this? And I think in the beginning of this segment, you spoke on it, increased suicide rates, increased male gender-based violence. These are the sequelae of, well, I guess, for lack of a better term, what toxic masculinity will lead to. I don't know. I'm just going to speak for myself, but you're raised in a society where I come from, the age where people had the tigers don't cry mentality. Something happens to you and you feel sensitive about it and you cry about it. You get called all kinds of other funny names afterwards. And I think in part of my growing up is that my father was always a very supportive guy and would allow you to have an outing to your emotions. But as with all young men, I think the important bit is to find your anchor in this world. You know, you start worrying less about what people are going to think about you when you found the people who love you back. Once you've gotten that, then you don't really care so much what the dude on the street who hears you complain about the financial thing that's weighing on your head, that's weighing on your mind. When you complain about that, when you give outing to those negative and vulnerable emotions, the people who will love you, and they will give you your support. So it's about finding your place in this world. I think it makes a big difference. I think that once you stop caring about what the outside thinks, and you know that my person cares about me, my aunt, my uncle, my dad, my mom, my wife, my girlfriend, once you found that anchor and you can work your way around that, it does get a lot easier to talk about your emotions and give outing to them. And even if somebody gives you a negative answer, to talk it out and find, within that negativity, you can find an answer to some of your problems, or at least know what you don't want to do from there. So I think at the end of the day, it's about evolving as men, and it's about evolving to find your place in this world. Once you've found your place, once you're secure, once you've rooted where your feet are, your emotions grow stronger, I think. And then the toxic masculinity becomes a lot less of a, I'm going to shout at this person in my house because I'm frustrated, and more, I'm going to shout out the window and ask them how they're doing and ask them for support.
And you bring us to our next point, and thank you for sharing that. And I think you share something important there in men finding their security, because a lot of the reasons we take, or a lot of the risky behaviors we take, are because of insecurity. A lot of the things that happen in our lives are because of insecurity. And you mentioned also finding a grounding in our lives, and I think to add to that as well is also finding the right outlet and the right way to healthily express yourself. And it brings me on to the next point of then the link between mental health and physical health, because, I will always be a bias, and I've got this saying that movement is medicine, right? In that, in moving your body, you can heal a lot of things, right? It doesn't take all your problems away, but it gives you that clarity to deal. And I think the bigger thing here is that emotional regulation that I think sometimes as men we struggle with, and still something that I to this day struggle with as well, right? But we at least work towards it, because it's because of a lack of emotional regulation that one, like you said, Doc, lashes out at their partner because they're frustrated, or thinks violence is the solution, or starts to move in aggression in a world that doesn't need aggression. And I want to just unpack the link between that, and I want to throw this at Muzi, because I know he throws around weights every day. But how does exercise help you in dealing with everyday life, right? And I say this because as men, you take on a lot of responsibilities, right? We take on things. We want to be providers. A few of you mentioned it, that as long as things are okay around you, as long as things are fine, right, it becomes okay. But it's a lot. It's a lot to take on, and obviously we've got to find outlets and releases. And some say exercise is cheaper than therapy. So, Muzi, I'm gonna throw it out to you and say, how has exercise or movement impacted your mental health? Have you found that it's become a healthy outlet for you?
For sure. As an athlete, I think it's one of the perks, that you get without knowing at first, But I think I've learned recently that the most underrated healthy habit that I've been like ignoring is sleep, outside of like running, playing soccer, whatever I'm doing, hiking. But sleep has been, and when I started focusing on like, what, let me be strict, my 8 hours or 6 hours and a 2-hour nap, I could see that, you know, I'm much more clearer in the head, even like when you seeing like issues arising, you know, you don't get as agitated as you would, you know, when, like, for instance, drinking, right? You get like very touched, or you'd feel like, yo, no, I'm very angry. But with exercise and sleeping and, you know, ensuring that, you know, I'm maintaining those healthy schedules, I'm always at a more calm state than I would doing something else, you know. And I think I would do that because I had stopped like exercising for like some years, maybe like 3 years. And that was one of the worst times, you know, for myself. Even like just trying to get ideas out, you know. So yeah, I think outside of gym, throwing around weights and, you know, tackling people, I think sleep should also be one of those things that you prioritize, you know, get that mind to rest, you know, and I think you'll be better off, you know, and drink some tea also. Drink some tea.
Muzi, you're a lot wiser than I thought you were. That is some of the best advice I've even heard myself, especially in a culture where it's hustle, hustle, hustle. In a culture where you have to work, you know, money doesn't sleep. And you're right. I've also, there's the quote that says you can solve at least half your problems by getting a good night's rest, right? Because you rest your mind and you allow yourself to be creative. And also a reason why I mentioned that mental health and physical health is because, you know, it's been proven that exercise increases and helps our quality of sleep, right? It's been proven that it reduces anxiety, right? And that it can help 1.5 times more than antidepressants in treating depression, right? So it's a powerful tool that's there for us to use to emotionally regulate. But also another thing that it opens up is the ability, I think, to get into communities, right? So movement can look like different things, right? And sports is a great way. And quite often I feel like, you know, although it may not always be the thing that gets men to speak, it can always be a great segue. You know, we know that someone moving their body will automatically feel better, and it's a way for them to heal. And in feeling better, you start to look for better options and better solutions and more ways for you to heal your well-being through that, right? And you're with community. So Patamedi, with that, you know, how outside of exercise, how else can we create spaces and environments where men can feel a part of something, and can also be vulnerable as well?
Yeah, I think that's a brilliant question, to tie those two questions together from the previous to this one around physical health. Just from like an experience that I had earlier this year, I went through like a trauma ACL, so like knee surgery and the entire thing. Won't get into that spiel, very painful and laborious experience, but it was the lack of movement that made me realize how important it is in my life, right? And not just like physical movement, because then the physiotherapy is going to gym and like it gives you, as Muzi touched on, the clarity of mind, and you realize it's not that deep, fam. Work it out, push some weights, life is good. But also just the inability to move about, just taking a walk in a park, being able to go see friends, because now I'm limited, right? I'm like hindered. I feel that because of the injury, I can't move around. I can't be seeing some of my friends and family, and just things like that. Just the spaces that we have that sometimes we take for granted. Nyanga, you mentioned like this hustle culture, right? Money don't sleep, and therefore we have a lot of men who are just like on the grind 24/7. When are you seeing people that you care about and care about you? When are you taking a walk in a park? When last did you take a swim? And it's just making sure that it was my wife who recently mentioned this thing that we have. It's not just a single thing, but like so many things around us that keep us well in our lives. So it's like gym, it's like family, it's like church, ensuring that not only do you have these spaces, but that they're a part of your life. The struggle I've had is like the balance for this. Sometimes like, oh, I don't do enough. I need to be working harder. So then work takes the majority of my life, and then I don't attend church, or I'm not seeing as much of my friends and family. So it's like making sure these spaces exist, but also making time for this in your life, having a holistic life, I think is the answer I want to give you there.
And that's a great answer. We're very short on time, and a big part, or at least a big thing I want to touch on when it comes to men's health as well here, is our financial well-being as well. So within this conversation, we've spoken about the medical side, which Dr. Leroy gave us a wonderful presentation. We've spoken about physical health, we've touched on our mental health, and we've also in that spoken about the quality the importance of relationships, right, and ensuring that we have a social health and making time for our loved ones. But one of the big things when it comes to men as well is our finances. I feel like sometimes, not sometimes, all the time, we measure our self-worth based off how much is in the bank, right? So as a provider, you only are able to see, what you are or what the weight of a man you are based off how much you have, which of course causes a lot of stress, right? And of course it's a number that moves, it goes up and down, right? And you can't attach your worth to that. And I wanted to just touch on why, as men, financial wellness is important, and also going into the season we're stepping into, right, of December and festivities and houses needing painting and kids needing gifts and Christmas gifts and all the things that are going to require some financial muscle as men. And that's not to leave out all the women in the room who are providers as well, but just in the context of this, right? Because I think it's also important that we learn to set boundaries as men when it comes to this, not only for financial, but in other things as well. So, Nduduzo, I'm going to throw this at you. Why is financial wellness important as a male, and how can one set boundaries when it comes to that, and in just protecting yourself and your loved ones, essentially, when it comes to this aspect of our well-being?
So I think I'd probably use an analogy I think that the good doc used earlier in terms of our grounding, right? I think it all starts there because I think to the point that you just made around, especially right now in the December period, a lot of men, and excuse my French, it becomes almost like a dick measuring contest, right? Around what you can. It doesn't become about what you can do for yourself or your family. It becomes about what you are able to do better than the Joneses, right? And I think then couple that with, I guess, what was earlier in the early 2000s, and then I'm giving away my age, and the late 90s, in terms of instant gratification and the MTV culture around people wanting more and more and more for the sake of wanting more, without proper grounding and actually understanding why you want what you want, I think is what actually perpetuates financial distress. And I think the answer, in short, again, going back, is I think grounding and understanding what matters, right? Why, for instance, you wake up every day to come and hustle, what you're doing it for, right? And what the actual true value of what wealth is, right? Is it providing for your family? Is it reaching your dreams and aspirations that have no connotation to the next person, but are truly intrinsic to what you want to do and achieve as a person? I think those are the foremost and fundamental ones. And I think also, again, to what Patamedi and Muzi also alluded to, making sure that you have a community and you surround yourself with people who either share the same values or would be supportive of you in terms of what you want to do and what aspirations you have, regardless from a material wealth perspective. I think for me, those, I think what would be, I think, the best way from a financial perspective, because that's the only way then, I think you then aren't trying to keep up with the Joneses all the time, but you actually know what you're trying to achieve.
And again, like you said so brilliantly, it brings us back to that, having that grounding, right? Because, the next question I was going to throw at Dr. Leroy and to the audience as well is then, with that, how do you manage the pressure of family support, right? So taking care of one's family, one's siblings, one's elderly parents, when all these things are faced upon you, right? And you feel like, again, you need to go more than, how do we have those hard conversations, Dr. Leroy?
So what I would probably start by saying that we should start having those conversations. I think to bring it just back to the money thing, read a book which opened my eyes to, what direction I needed to go in with finances, and made me realize exactly how much of a moron I was with my money, to be frank, for quite some time. And the reason for that is because I don't think that too many members of my family pulled me aside and told me, listen, man, you need to set up an emergency fund for yourself. And it needs to be big enough for you to sleep well at night so that, you don't have worries that, let's say you lose your job, you can cover yourself for the next 6 months. That kind of thing, having an emergency fund, making sure your insurance policies are taken care of, making sure your kids are taken care of, making sure that when you go into the store, you're not counting the pennies and looking for the coupons. And there's nothing wrong with having to do that, because at some point we all, have to scrape things together and pray that we make it through the week till the 31st. But the other thing I would also say is it's the keeping up with the Joneses. And I think in the last 10 years that has, skyrocketed with, you've got Instagram now. Guys are posting what they've got, 50, a whole day. Like if you put on your notifications, you're never going to stop seeing guys spending money and having a good time and looking sexy and basically living that MTV life. And I think the most important bit of that is the empty part. It's easy to throw money away after a good time, but half the time you're drunk, you're not going to remember it. So it's about having those initial conversations. What is the financial number that you need to have in the bank for you to feel safe day to day? Getting that number, starting to know where your policies are, know what you're paying for, because it's very easy to get bamboozled by things that you haven't read the contact track properly. Sit down, ask somebody, listen, man, tell me what I'm paying for, and taking care of your finances from the most simple perspective relieves a lot of anxiety and a lot of problems that guys are having sleepless nights about. When you're not trying to show off or impress somebody, but you're feeling safe and secure, and the best car in the world is one that's paid off. That's all there is to it.
Now that is a way for us to wrap up. I will remember that. The best card to have in the world is the one that's paid off. Thank you, Dr. Leroy. Thank you to our amazing panelists as well. I think this has been such an insightful conversation, right? And of course, we only had an hour. We were never going to be able to cover all the things men deal with. But the whole point of this conversation was to raise some awareness of some of the men's health issues that are out there, to get some medical advice from Dr. Leroy. And also, just a disclaimer, none of this is professional advice. We're not trying to give any advice. We are just trying, except for Dr. Leroy, except for us to just really raise awareness on what's happening in our world around us and what's happening to the men around us as well, around issues we're dealing with too. We have come to the end of the session. I do want to just leave space for some questions in the audience. So I'm just going to ask for a few questions to be popped up if there were any. The first one I'm going to throw is, why is men's mental health linked to being physical? It's either we are being violent or we must be physical to get better. For me, I feel like that's a loop. Okay, that's interesting. Patamedi, I'm going to throw this one at you as we were speaking about the physical. And Dr. Leroy, I know that we have reached past 2 o'clock. We know your time is money. So if you need to drop off, during while we answer these questions, we will only take 2 more questions. Please feel free to leave. And thank you so much for your much valued time. Patamedi.
Thank you very much for the opportunity to speak to everybody, and I hope that we've opened the eyes to urologists aren't that scary. We're actually quite nice guys.
Thank you, Dr. Leroy.
Thank you. Interesting question here. Why is mental health linked to being physical? I don't have the exact answers, but I know that there is something men often talk about, like the need to do. So like stereotypically often like envisioned as like problem solvers, so like get your hands in the dirt, get things done. But it's almost like a physical need, that a desire to do things. And for me, it's felt like this physical itch. If there's a problem, you know the joke around, a woman will tell you something and she just wants you to listen, and you just want to solve the problem, and then it's like this back and forth. It's this desire that I can get it done, I can fix, I can solve. So my body wants to get involved in this, and if it feels like it could go either way. If I'm not mentally in a good space, then there's this build up in this frustration that I'm assuming some men would express in unhealthy ways, where if I'm going to gym or if I'm running and I'm exercising, it's that same itch that I'm scratching, but in a positive way. Again, not professional, but this is how I read it in my body.
No, I agree as well, and I think when it comes to mental health as well, it's not and physical health, it's not necessarily always linked to men. I think it's a general term where we know that mentally it will affect your physical, right? And I say it in the sense of, if you've ever felt stressed, if you're feeling stressed, that translates into the physical, right? When you have, your shoulders tense or your neck is stiff, or if you're feeling a feeling like anxiety, where your stomach, you sort of feel that your immune system, you're feeling nervous, you want to go to the bathroom, right? So there'll always be a link between mental and physical. And I think in this context, it's to understand that we have to look after our physical health if we also want to improve our mental health. It's not to say that, if you don't, you won't be able to do anything at all, you won't be better, but it's to say that there's definitely a link. And yeah, next question. Wait, so is tea good / not good for you? I need pro advice. Muzi, you told the people to drink tea.
Yeah. My top 3 would be green tea, apple cinnamon and cranberry tea, and then also peppermint. Very healthy tea. You won't go wrong. You won't go wrong, and that is professional advice right there. But just doubling back on one of the questions about violence, I'll always say this: violence is not the answer. Always try and de-escalate. I think we've all seen where people acted out in a violent way, where they've ended up, and they've all regretted it, and I don't think that would be, a good outlet. So one thing you must always know: the most important business you'll ever have to manage is the business of your life. Relationships, money, mental health, and violence will never be one of those answers that you can lean on, to solve anything, So,
Agreed.
yeah.
Agreed, and thank you for sharing that, Muzi. I think that brings us to the end of our session. Nduduzo, Patamedi, Muzi, gentlemen, thank you so much for stepping forward. It's been a great conversation, and like I said, one can only hope that we make a difference and we allow other men, to step into environments that they can speak to, right? To start finding spaces that they can be confidential in, right? To start demything and debunking of a real man and being a man, and to not rely on self-reliance, to know that we can ask for help, and that the world is not against us, and that it's safe and we can live and be vulnerable, and be the modern men of today. So thank you again, gentlemen, and have a wonderful weekend.
Thanks, Yanga.
Thank you so much.